buildings was our big main dispensary where we had the OR, the lab, ER, dressing, consultation, pharmacy, many different departments. And then the other two buildings that were built were our wards, which was a men's ward, women's ward, pediatric, and then we had one overflow. So these buildings were built in about 2009, but now we just refurbished them so that there's better working conditions for our staff and also better conditions for our patients. So do you want to just come on in with us? So when our patients come in, maybe I will quickly just show you exactly when the patients come in, the flow of things. So they'll come in, they'll go to triage, then they will go get their, for those who have worked overseas, their carnet, their health book, and they'll go pay for that. And then from that point, they will move them to either the consultation waiting area, and that area was the ESSO, ExxonMobil, gave money to construct that area. And then over here, they'd come over here if they need dressing changes, ER, and also the surgical clinic. Here we have the pharmacy. So after patients see the consultant, they will come here to the door and go ahead and get their medicines on their way out. So we'll just go right through here and I will continue to show you. This was the original entrance of the hospital. We have done some refurbishing so that the flow of patients is much better. How about let's go into the pharmacy? Bonjour, comment ça va? So, je suis en train de, ça c'est Cléopas, c'est bye. So this is the head of the pharmacy right now. He's working directly with Claire Bedford, who's a pharmacist from England, who's one of our missionaries. So this is his area. So we have a stock room over here with all our medical stock and our medicines back there. And then the drugs are dispensed from out there. So patients will come up to the window and they'll go ahead and get their medicines from here. We now are excited because we've had computers. We've been computerizing our hospital little by little. And so in the pharmacy, we have a computerized system. Here we have a mural that was painted by a missionary from a Norwegian, I think that's right, a Norwegian artist, and showing the tree of life. Of course, we know it's Jesus Christ, and the river that we are fed through that. We're fed by the Holy Spirit. So the other thing we wanted to show the people, so on this mural we also have a map of the world because we want people to know that people from all around the world are willing to come here to the hospital to help the people here. Because Chad, as you might know or not know, it's probably the third or fourth poorest country in the world. Here is our consultation rooms. Patients will come in from outside and then they'll be called by the nurse. We have usually 3 or 4 nurses who work in this area and they see the patients, and then after that, if they need to, tu peux venir. And after that, if they need to, they will see the physician. This is Musa. He was here when the hospital started, and he's one of our consulting nurses. So we'll keep on going a little further here, and we'll come to our lab. Hello, bonjour. Comment ça va? Mangaela? Alors, this is our lab. Je vais dire un peu en anglais et en français. This is our lab, and we have just opened up walls in this lab to increase what we can do. Now we can do NFS, TSH, enzymes, so that we just got this new machine here to do TB testing and HIV testing. More c'est pour. Oh, it's okay. It's only for tuberculosis. So we do have. So the lab is just starting to grow more and more. And we do about 6,000 tests in the lab per month. Okay, merci. So for blood banking, patients who have to have surgery, they have to bring a relative to donate blood, and we do direct. Then we give the blood to the patients. This is our Dr. Blaise and our staff. They're just doing their ward rounds every morning. So we're just walking through. Okay, and then we also have our physical therapy department. We do a lot of orthopedics. We have a lot of orthopedic sign nail patients that are here, and we have bedside physical therapy too with our staff from physical therapy. So in these wards, in each ward, we have 9 beds in this ward. So you have men on, now we have men on both sides because we have changed a bit our wards, and we have another ward in the back for mother and baby and children. So we have now 3 men's ward because we often have more men than women coming to the hospital. So we can just go through here. This ward was bonjour tout le monde, ça va? Ça va bien, merci. So this ward was refurbished 4 years ago. So we'll go through here. Right now, this ward was the women's ward at a time, then it became pediatric ward, but we were refurbishing the ER, so now we are using this area as an emergency room, ER. Immunization and prenatal clinic is in this building, and our breast clinic center is in this building, and we'll talk more about it in a few minutes. So this at first was our first OR in this area with our recovery room, but it became the ER, and now it's been an expanded emergency room. So, okay, so we'll go back. When we started, this was our maternity. It was a 4-bed maternity. Now we have a 10-bed maternity. Now this is our surgical clinic. Probably some of you know Bert Oubre, my husband. He is a surgeon, so a lot of the hospital was a lot of general surgery, visceral surgery. Now it's become more of an orthopedic an orthopedic hospital than it was visceral. But we're hoping to get some more physicians on board, some more general surgeons, and that will help us go back to visceral surgery more. We had a missionary from England who was a music therapist, and so she started a child development center, and now we're seeing 8 to 10 patients twice a week who have autism, who have CP, and just different neurological problems, and been working with them with the physical therapy department. That's been a real blessing to these people to have this department and to work with the children. We also have a psychologist who is working with the families to help them, because many times, as you know, in Africa, these children are hidden or not taken care of. So people have been really happy. They've seen progress in their children. So they've been very happy with the program. We can go ahead into our physical therapy. So it is a combination of physical therapy, and we have the Child Development Center in here. I think we have one of those little children there who is learning how to walk with his little bike. Ça va, petit? Ça va? Youssouf, Miguel, ça va? So this is just where they do their treatments for the patients. Yeah. Okay. So we have bars that parallel bars that the staff that was made here on the ground. Bethan, who was the music therapist, this I find is really cool. For most of these patients, they don't have much money, and so Bethan had made these out of paper mache. It's little chairs. People could afford these, or we can use them here. Whereas if it's a wooden thing, the people would definitely not have the money to do it. So it's really cool. Again, it's another waiting area, and they're now here. It's our ultrasound department, and they're waiting to get into the ultrasound department. Also, in front of our prenatal clinic and immunization, we have a TV that's usually on. The people are a little late today because of the rain. It's usually on, and patients can watch teaching videos on breastfeeding, immunization, prenatal clinic, importance of all of that. It's in French. We are getting it translated to Arabic and also Dazaga, a Goran. It's a language spoken by the Goran tribe. So this is our X-ray department. We've with the rain. With the rain, we've had a little problem with our roof, so it's not usually quite like this. But this is the X-ray unit we have. Right now it's a portable X-ray unit, and we were blessed by the Swiss government with a digital printout for our slide. So we have digital X-ray now, and you can see it in there. On peut passer par là, celui-là. Okay. 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 Merci. So we're gonna keep on going. Bye bye. Bye bye. Ça va. Okay. So over here we have 3 private rooms for our patients. We also have a ophthalmology clinic. We do it once a week on Wednesdays, and then on Mondays we also just started an audiology department. It's especially for testing newborns for with their hearing, and we are starting to do more and more. It's a Swiss mission called Écoute-moi, Listen to Me. They're working with a school for the deaf here in town, but they wanted a hospital to be associated with them. So we're doing hearing tests, and they're hoping to do to keep on going, and hopefully at some point doing cochlear implants. This is Agnes. She is our nursing director here at the hospital. She's taken my place. She's learning English. But she speaks many other languages. OK, on va avoir une équipe d'Américains qui vont venir aussi. We have 3 Ethiopian pastors who are working with it, missionaries with AIM who are working with us. Again, as I said, our goal is to reach the unreached people. So they're here, they visit the patients in the wards, pray with them. They also go out in the community, especially for those who live around this area, and they will visit them in their homes. So here, when we started out, we had 4 beds, 4 labor beds and post-op beds, and this area was our prenatal clinic, nurses station, and we have 4 delivery rooms. But we were able to refurbish this area about 4 years ago, and now we still need to increase the unit. We have days. We have the other night, 2 nights in a row. I asked the nurses, "Well, how many babies did you have last night?" They said 8, and one of them was a section with twins, and so many times during the months of September, October, we have a lot of babies, and women are on the floor because we don't have enough beds for patients staying. For postpartum and prenatal to stay here in the wards, in this ward. I didn't explain it very well. Okay, so here's our beds, our various postpartum beds. We have the 4 delivery rooms here. So this is what we have right now. Okay, we can keep on going. Bonheur, ça va? Bonheur. Oui. Ça va, ça va bien. So Bonheur is right now the head of maternity because other people have gone on maternity leave. Okay, à plus tard. Merci. This is our OR. We have a 4-room OR, 4 surgical suites. One is not really being used right now as a surgical suite, but we do all cases here. A lot right now, our primary, as I said earlier, is orthopedic surgery. But everything is the C-sections, GYN. We can come in and go so far. You can just see the inside. So we have pre-op, post-op, and yeah. Bonjour, ça va, Adolphe? On fait juste. So this is our pre-op and post-op, and the surgical suites are in the back. So a lot of our anesthesia is still being done under ketamine and spinals, and we do have a general anesthesia machine, but we have a nurse that's right now doing a CRNA program here in Chad, one of the nurses that has been with us for over 10 years. But we do need an anesthesiologist or a CRNA to come and work alongside with us so that we have better anesthesia for our patients, which I would like a good anesthesia. Our last building that you will see here is our new, it's supposed to be our women's and also postpartum unit over there. Right now, because of the renovations, we have pediatrics here over in that building. So we'll go down this hallway. We're very grateful to Samaritan's Purse and BMS, Baptist Mission Society, who provided funds to finish up that, no, I'm sorry, it was MIA, Mission in Action, I think that's what it is. And anyway, it's a British organization who has provided funding to build that building. We can have up to 13 beds on either side of the ward, and it's nice and airy, and the patients love it. Everybody wants to come and stay over here, even though their areas have been refurbished. So these are our wards. This is the women's ward. And so the women's ward, and then we'll go over to the pediatric ward. Many times here, well, now people bring their mosquito nets, so you have them all over, which we're very grateful. The government has just given us more mosquito nets, and we do give them out at the prenatal clinic. So that's where we hand them out, prenatal and immunization clinics, so that the kids and the pregnant mothers especially have them.